Hi guys, so let me introduce myself. My name is Erindo, a medical student, and I love being a medical student. So as I told you, we'll be talking about pneumonia. So we'll be talking about medical conditions that we get along in the outpatient department and the inpatient. So I'm going to start with pneumonia. So pneumonia, you have seen it many times in the outpatient department. What do you think it is? It's simple. It's an inflammation of the lung tissue. You know, many times medical students we like to think about strange terms, but that's what will get you in trouble during assessments. So just say it's the inflammation of the lung tissue. That's all. So let's go to the next. What is the symptoms that you see in pneumonia? The symptoms. It's very simple. I think it's one of the most simplest questions you can be asked by a consultant. So symptoms, it's just simple. You get fever, elevated fever, you get cough, you get fatigue. The cough maybe is productive or not. It can be dry or productive. And if it's productive, if it's bloody, it can be caused by maybe Klebsiella. So it can be caused by pneumococci, streptococcal pneumonia. It's an organism, microbiology. You have learned that one. So you have learned symptoms: fever, cough, fatigue, chills, sweating, vomiting, diarrhea. There are many. You know, it presents differently in every patient. So how do you diagnose pneumonia? You have seen the symptoms, you have seen the definition. How do you diagnose pneumonia? I know it's one of the simplest actually medical conditions that you can diagnose without even needing lab investigations. Just a good history, physical exam is enough. So if you combine the chief complaints and then you do a good physical exam, a good physical exam involves you have to ask artists the lung tissue for crackers. You know, crackers are added with sounds. We learned that in first year. So if you auscultate the lung tissue, maybe the affected area, you will hear crackles. So if you can also do a chest X-ray. A chest X-ray will actually show consolidation around the affected tissue. So if you combine a good history, you look for auscultate for crackles, you will hear them, and then um, you do a chest X-ray and you will see consolidation around the lung fields. How do you see consolidation? You know, many maybe medical students don't actually know what consolidation is, don't know how to check it. So if you see an X-ray and then you can't tell the margin of the heart clearly, they're just whitish, that's consolidation. You can't clearly mark the margin of the heart, that's consolidation. So you have seen how the pneumonia is diagnosed. So then let's start treat it. Let us treat it. So treating it involves resting, antibiotics, taking plenty of fluids. Antibiotic, I mean, it can be severe. You can take crystalline penicillin, or you can take ceftriaxone. But if then it's pneumococcal cerevisiae, I mean, if it's pneumocystic cerevisiae pneumonia, which is commonly in those who are immunocompromised, you give Septrin 120 milligrams in 4 divided dosage, and then you add prednisolone. It's it works very smart. So you have treated pneumonia. Now, what are the complications that we can have in pneumonia? So one, pleurisy. Actually, the lung tissue actually it's pleuritic. The second one is septicemia. Septicemia is a very dangerous condition, by the way. Very rare, but when you find it, it's very dangerous. It's very fatal. A patient can just die in a matter of minutes. So yeah. So we have learned about pneumonia today. Please subscribe so that we can learn more. in the coming days. Just here down, subscribe, and then we're going to talk more. Thank you.